Two girls from Rajasthan recently died due to Chandipura virus. Now, they were undergoing treatment in Gujarat in recent days after testing positive for a Chandipura virus, CHPV. With cases often reported during the monsoon season in Gujarat, the Rajasthan Health Department is now planning to set up surveillance in the bordering western districts of Dungarpur, Sirohi and Udaipur. As of Friday, July 24, 9 confirmed CHPV deaths have been reported in the current outbreak, of which 7 are from Gujarat and 2 are from Rajasthan. Now let's talk about this Chandipura virus. It belongs to a Rhabdoviridea family, the same virus family that includes rabies, although it causes a different disease. It was first identified in 1965 in Chandipura village in Maharashtra, India, from which it gets its name. Now this virus is known to cause acute encephalitis syndrome, AES, a serious condition that leads to inflammation of the brain. Although cases are uncommon, outbreaks have been reported in different parts of India over the years, with children being the most affected group. Now, most reported outbreaks have occurred in the western and central India, particularly during the rainy season. Now, let's talk about the transmission of this disease. See, it is a vector-borne disease. It's a vector-borne virus, Chandipura virus, and primarily spreads through the bite of infected sandflies, which are tiny blood-feeding insects. Now, some studies have also suggested that ticks may play a role in transmitting the virus, although sandflies remain the main carrier. There is currently no evidence that CHPV spreads directly from one person to another through coughing, sneezing, or physical contact. Also, the virus resides in the salivary glands of these insects and can't be transmitted to humans or other vertebrates like domestic animals through bites. Now, the infection caused by the virus can then reach the central nervous system of humans, which can lead to encephalitis, inflammation of the active tissue of the brain. It means that, and it can lead to severe health problems. Now, this is about the transmission. Now, let us talk about the symptoms of Chandipura virus. See, the CHPV infection initially presents itself with a flu-like symptom, such as acute onset of high fever, severe headache, vomiting, weakness, and tiredness, or muscle pain, irritability, or unusual drowsiness, convulsions, or seizures. Also sometimes confusion or loss of consciousness, in severe cases of course. Now it may then progress to altered sensorium or seizures and encephalitis. Now retrospective studies from India have also reported other symptoms such as respiratory distress, bleeding tendencies, or anemia. Now the infection often progresses rapidly after encephalitis, which may then lead to mortality within 24 to 48 hours of hospitalization, according to studies. Now, the susceptibility has largely remained limited to children below 15 years of age, and it can progress very rapidly, of course, in children. In some cases, symptoms may worsen within a short period of time and lead to serious complications involving the brain and the nervous system of humans. See, this CHPV can cause high case fatality ratios, ranging from 56% to 75%, as reported during the previous outbreaks in India. But now the question is, how can this infection be managed? See, the infection can only be symptomatically managed, as currently there is no specific antiretroviral therapy or vaccine available for treatment. Now, as a result, it becomes crucial to manage brain inflammation to prevent mortality. Disease progression can be as rapid as a patient reporting high fever in the morning and their kidneys or liver being affected by the evening. This makes it harder to manage the symptoms, according to several pediatricians, which is why this is a very serious problem. Now, let us discuss about what are the worst affected areas or regions in India for this virus. See, as you all know, that this CHPV infection was first isolated in 1965 while investigating a dengue chikungunya outbreak in Maharashtra. However, one of the most significant outbreaks of the disease in India was seen in 2003-2004 in states such as Maharashtra, northern Gujarat, and Andhra Pradesh, with the 3 states reporting more than 300 deaths of children. Gujarat, during the 2004 outbreak, saw a case fatality rate CFR of around 78%, while the CFR in Andhra Pradesh during the 2003 outbreak was pegged at around 55%. Now, the infection has largely remained endemic to central India, where the population of CHPV infection spreading sandflies and mosquitoes is higher. And India's virus and pandemic protection mechanism, it relies on several institutional frameworks, which is why whenever such cases of viruses are reported in India, we have a separate institutional framework to deal with this. Now let's talk about those institutional frameworks in detail, since now we have a lot of details about this Chandipura virus, which is CHPV. Now when we talk about institutional frameworks, there are frameworks like the ICMR, that is Indian Council of Medical Research in India. Then there is Integrated Disease Surveillance Program also in India. We call it as IDSP. And not just this, we have National One Health Mission also. Now, these are our frameworks. Other than this, we have key institutional pillars also. One is ICMR and NIV, which is the Indian Council of Medical Research. It leads Apex Medical Research, while the National Institute of Virology, NIV, handles high-end viral isolation, characterization, and diagnostic validations. Then we have IDSP, which is the Integrated Disease Surveillance Program. It tracks disease trends and district-level outbreak signals through a decentralized IT network. And then we have NCDC, which is the National Center for Disease Control. It manages rapid response teams for cross-border and multi-state outbreaks of public health concerns. There are several strategic frameworks also and approaches in India to solve these kind of outbreaks. One most popular amongst them is One Health approach. Now this integrates humans, animals, which is livestock, wildlife, and environmental health sectors to mitigate zoonotic spillovers, probably like Nipah and avian influenza. Then we have second framework or second instrument, which is genomic surveillance, which is coordinated via the India SARS-CoV-2 Genomic Consortium. It is the reason for it is to track viral mutations, variants, and transboundary strains. And then third, we have biosecurity and biosafety infrastructure, which establishes tiered laboratory containment standards BSL-1 to BSL-4 to safely handle lethal pathogens like Ebola or Crimean Congo fever. Then the fourth one is Disaster Management Act. Now this institutional framework empowers national and state executive committees to invoke emergency containment, lockdown, and resource mobilization during severe biological threats. See, we all know that the COVID-19 pandemic exposed that nearly 60% of emerging infectious diseases in our country or the world are zoonotic, underscoring the deep interlinkages between human, animal, and environmental health. Against this backdrop, the One Health approach has gained a global traction, reflected in the 2025 WHO Pandemic Agreement and India's National One Health Mission. Now, with climate change, antimicrobial resistance, and habitat disruption intensifying disease risks, isolated sectoral responses are increasingly adequate. Thus, One Health emerges as a data-driven collaborative framework essential for future pandemic preparedness and sustainable public health governance in our country. Which is why now let us try to understand what is this One Health approach in a very simple way. See, first of all, the One Health approach is an integrated unifying framework that aims to sustainably balance and optimize the health of people, the health of animals, and ecosystems. So the three pillars of One Health. The approach rests on the core idea that we cannot protect one of these pillars without protecting the other. First pillar is human health, ensuring the physical well-being of populations and preventing the spread of diseases. Second pillar is animal health, protecting wildlife, protecting livestock and domestic pets from disease and ensuring sustainable agricultural practices. That is the second pillar. The third pillar is environmental health, maintaining healthy ecosystems, clean water, and a stable climate, which are foundations for both humans and animal survival. Now, what is the need for India to shift towards One Health approach? That is a question. See, the first reason is mitigation of zoonotic spillover risks. India's high human-wildlife interface, it makes it a primary theater for pathogen spillover, where viruses jump from animals to humans due to habitat encroachment, because urbanization is very rapidly happening in India. While nearly 60 to 70%, 75% even, of emerging infectious diseases are zoonotic, India currently monitors these in silos and often missing early warning signals in wildlife. So the International Livestock Research Institute reports that 13 zoonoses are responsible for 2.4 billion human disease cases and 2.2 million deaths in India annually. The recent outbreak of Nipah in Kerala and Kaisanur forest disease KFD underscore this. That is the first reason One Health approach is required in India. Second reason is combating the silent pandemic of AMR, which is antimicrobial resistance. It's again a very, very important issue in India. AMR in India is fueled by the interconnected use of antibiotics in human medicine, poultry, and aquaculture, leading to super bugs in the environment. Now, without a One Health lens, regulating antibiotic runoff from pharmaceutical hubs or livestock feed remains impossible, rendering life-saving drugs ineffective because of antimicrobial antimicrobial resistance. India's NAP-AMR2 25 to 29 highlights that multi-drug resistance pathogens that are contributing significantly to hospital mortality. And studies show antibiotic-resistant bacteria are now prevalent in effluent samples from major Indian river systems. That is the second reason we should have one health system. The third is the food safety and nutritional security in India. Our food chains are contaminated, either sometimes due to pesticides or zoonotic pathogens, which are probably present in meat or some places. Directly, they are impacting India's national nutrition mission, which is our Poshan Abhiyan. And foodborne disease in India are costing India roughly around $15 billion annually in lost productivity, reflecting a significant economic burden in India. And they lead to increased healthcare expenditure, reduced workforce efficiency, and long-term impacts on human capital. Now, One Health ensures farm to fork safety by monitoring soil health, irrigation, water quality, and veterinary drug residues, which are vital for a healthy, productive workforce, which is why One Health approach is required in India. And the fourth and the most important reason is the strategic global leadership, which is Viksit Bharat by 2047. Now, for India to lead the global south, it must pioneer a scalable One Health model that balances development with ecological safety by successfully implementing the National One Health Mission. See, India sets a template for tropical high-density nations to achieve the SDGs while protecting their GDP. And the Union Budget 2026-27, 24% increase in allocation of Department of Health Research, which is over around 4,821 crores, can act as a critical enabler, strengthening integrated research and surveillance system and positioning India as a global exemplar in One Health-driven governance. So till now, we have definitely talked about Chandipura virus, from where it originated, what are the symptoms for it, what is the treatment available, how it can be prevented, what measures can be taken, what measures India is taking, health framework India is having, different layers of those health framework, and in detail about the One Health approach of India. We've discussed it all, but let's not forget that this Chandipura virus, it poses a serious public health challenge due to its rapid progression and high mortality rate in India, especially amongst the children population. So continuous efforts in vector control, public health awareness, and research that are very essential to mitigate the impact of this virus. Understanding the virus and transmission dynamics of Chandipura virus is crucial for developing effective public health strategies to control its spread, particularly in the endemic regions and particularly during the peak transmission seasons. Now, what more can be done for India to combat these type of outbreaks? If you have any suggestions, do let me know in the comments section. I'll be very happy to read them. I hope you gained a new perspective today. All the very best and have a beautiful day. Thank you.